Competitive sports have changed quite a lot in the last 10 years. I'd say I see more and more kids specializing in one sport, and that can lead to overuse injuries. So we always recommend that kids get out, try something different sports. It helps even with the sport they're most interested in, because it helps develop their different movement patterns, helps decrease those overuse injuries, so it's really important to kind of be a well-rounded athlete. Most of what we see, are the ankle sprains, knee injuries, shoulders, things like that. We have a lot of patellar tracking issues, especially with young females. The kneecap doesn't track properly, and that can cause pain. A lot of those are overuse. We'll also see acute injuries, so the MCL injuries, the ACL injuries. My name is Lindsay Hagler. I'm a certified athletic trainer for the Center Foundation. Our main goal, is to prevent injuries to start with, and then if they do happen, then I'm there at the time of injury, able to look at them immediately, figure out what kind of care they need, and then initially provide that care, and then if it's serious enough, we can refer them on to get further care. I see the most injuries. That would be football, soccer in the fall, just due to the nature of the sport. My biggest concern with knee injuries in high school athletes would be the young females. They're obviously at the highest risk. They have some anatomical differences, obviously, to boys, and that can affect the way that they land, the way that they run, can then put additional stress on the ligaments, which quite often comes into play with the knee injuries. It's also been shown that ligaments are a little bit more lax in girls, and that can play a big part in that as well. The biggest way to prevent knee injuries would be strengthening. Neuromuscular control is important. Again, those quads and the hamstrings really control that knee movement. Also focusing on the hips, because that also plays into part of the knees and how they work. If athletes can do preventative strengthening to start with before the season, that can make a huge impact through the season for preventing injury. Working on hamstring strength as well as quad strength can be very beneficial to preventing those knee injuries. Also, if the severe injuries are not taken care of properly, they can lead to lasting effects, which could then affect them once they get into adulthood, which might then limit their activity level. So we'd always like them to be as active as we can, so treating them quickly and properly to start with can help reduce those kind of lasting effects of injuries. Really, our mission obviously is to prevent injury, but when it does happen, we want to get those kids back as quick but also as safely as we can.